Alright, so for next of the next injury which we'll be discussing right here is what is known as the Essex-Lopresti injury. Essex-Lopresti injury. So this Essex-Lopresti injury is quite simple. It just has to do with there is a tear. Alright, there is a tear in the interosseous membrane. There's a tear in the interosseous membrane that is usually between what? The ulnar and the radius bone. You understand? So a tear in the interosseous membrane that is between these two bones. So it's a rare but it's a serious orthopedic condition. So this one, there's a longitudinal instability of the forearm, and usually it is because of what? High energy trauma injuries. Like when you're trying to fall, then you use your hand to like support your body weight. Okay, so it affects many structures in the forearm, you know. So this injury is a triad. Okay, so radial head is fractured. Radial head is fractured, 0.8. Okay, interosseous membrane is torn or ruptured, points it out. Then what? Distal radioulnar joint is disrupted. Okay, this is a distal radioulnar joint is disrupted. Okay, so these are the three things happening in Essex-Lopresti injury. Okay, with of course the interosseous membrane rupture being like the most prominent stuff you see there. You can see that they always, you know, the ruptured interosseous membrane is the thing they always talk about. So the mechanism of injury is caused by axial loading of the forearm. So force travels from the wrist to the forearm, it damages the radial head, it stretches or tears the interosseous membrane. Okay, so it's often missed initially, especially the distal radioulnar injury, okay, which can lead to chronic wrist pain. You understand? So make sure you always diagnose and start the appropriate treatment. So diagnosis is clinical sign. So you are looking at there's pain in the elbow and wrist, there's limited rotation, there's instability. They also go on to do imaging, just like I have here, you know, to pick up the issue on the imaging. Then images like x-rays, MRI or CT scans and all of that. So treatments: acute one, surgical repair or replacement of radial head, reconstruction of interosseous membrane. If it is chronic, may require what? Ulnar shortening, osteotomies, okay, and prosthetic replacements. Okay, so that's what we have here for Essex-Lopresti injuries.